have been with South Georgia Medical Center for a total of 8 years. I started in 2011, and I've changed positions about every 2 years, and it was pretty much based on the need or a little bit of opportunity, I think, on both my end and the organization's end to meet different roles. But I've enjoyed it. I feel like being able to start at the bedside and slowly progress rather than a rapid, from the floor to a manager was good for me, because it allows me to not forget the work of the floor, but also be able to explain to the bedside staff why we have to make different changes, and why different things are important, and to try to compare and meet in the middle on both sides. My favorite thing about working at SGMC is that you feel a part of a family. And although you may be designated to one area, you float within departments, you meet a lot of different people, and everybody's willing to help you no matter where you are. And you can always learn something different. Our culture of safety on, the whole hospital, not just 5 West, is patient first. And our goal overall with all departments is to put the patient first, no matter what's going on. We always want to make sure that we're doing what is best for the patient. And sometimes that means, changing up what we normally do or making extra phone calls, but whatever we have to do to keep the patient safe and keep them first and know that they're our priority is our goal. I would encourage a new grad or anyone that's just looking for a job opportunity, particularly nursing, to come to SGMC because there is so much opportunity. I feel like no matter where you choose to go in the hospital, you would have a great experience. And even if you chose a path that you felt like you didn't really like, or you got to where you just wanted to try something different, everybody's willing to work together. And so if I'm in med-surg, and if I feel like, someone comes to me and they're just like, okay, I think I want critical care experience, we don't discourage, we encourage. We'll talk to other management within the organization. HR is very helpful in trying to get people to what is the best fit for them. So I just feel like there's a lot of opportunity and options and opportunity for growth within the organization. I feel like I'm a good example of that. I started as a nurse intern, and no one forced me to move up, but based on the experience and opportunities, I was able to do that. So I would encourage that. It is big, but not city big. So it's a good happy medium. Great hospitality here. You have lots of options as far as restaurants, you have a mall, and it's a good location. You can still get to the beach, you can still go to Atlanta, so it's a good family town, I feel. A good home that I think everyone would enjoy. Well, as far as incentives within our departments, each different department kind of has their own spin on things. So some examples of incentives for, sometimes you're recognized when our patient relations department is rounding. Some patients specifically recognize certain nurses or certain aides. And so often we may do a meal ticket, or it may be, we have something in our unit called a kudos board. And so even staff within the unit, if someone's just been awesome, they take a little sticky note, pin it on the kudos board, and each, we'll either do like every 3 months or every month, just depends. We'll do either like a little gift basket, or even the staff has said, next time can we do movie tickets? So we even are very, understanding and listen to what our staff want, so that it is more incentive for them to do better. An advantage to being a nurse at SGMC and also wanting or allowing you to progress, there are options of both tuition reimbursement and the scholarship program. And depending on the criteria, all you have to do is apply, meet the guidelines, and as long as everything follows, it's a great incentive that helps you to better yourself, but you're also bettering the organization as you advance your career. Our DAISY committee, or DAISY award, is something that's fairly new to SGMC, but we enjoy it, and we think that it has helped to promote positivity and encourage our nursing staff and also the patients to be more transparent with the care they're receiving. I actually am a part of the DAISY committee, and it is exciting. Every month we receive anonymous submissions, and everyone on the committee votes on them. We don't know any names, departments, or anything. And so it's touching often to read the stories and just see what a difference that so many people in the organization have made. But it is good, even if we can only have one winner, but all of the recipients do receive a DAISY pin and an actual certificate. So I feel like it makes the nurses feel special, and it's just a little something to remind the staff. Sometimes you just need something uplifting of, why I started and why I do this, and the little things that I do make a difference. So I think it's been great, and I think that the staff really enjoy it.